So you get there, yeah, and there's sometimes like in most extreme cases they can sometimes do boreholes. Risk factors, genetics and family history. So again, do I want you to go through all these risk factors? And but this is the thing, interesting thing. There was a Swedish study, and oh, I know we're going over time, so I'm going to try to go end with these risk factors. If you have lab right now, by all means take a break and go to lab. Okay, so then there are many things that can increase your risk to aneurysms, and this is in this one of the study. I think it was only within the Swedish population, but what did they notice? Okay, they looked at people who have aneurysms, and they asked them like, okay, they looked at statistics and whether they had a parent or one of their children or one of their brothers or sisters had an aneurysm as well. And they saw that people who had one relative who had an aneurysm, that they on average, they were 2 times as risk as everyone else who did not have a relative had a relative that had an aneurysm. But if they had two or more of these relatives with the aneurysm, then they were 51 times more likely to develop an aneurysm than somebody who hasn't had a family history of aneurysms. And this is just one study. Actual numbers, do I want you to focus on these numbers in particular? Not these numbers. I won't expect you to know twice as many or 51 times as many. But in general, they find out, okay, if you have other people in your family who have had aneurysms, you're more at risk of having an aneurysm than someone else in the general population. And this is another study, and familial aneurysms. So within the family, sporadic is a fancy SAT GRE term meaning kind of like random. So these are people who have like aneurysms that develop compared to without family history. So they also noticed that these people who have a family history, they have an increased risk of rupture compared to people who develop it sporadically. And other things that affect aneurysm. Someone mentioned this earlier in the chat and lecture. Hypertension, high blood pressure, and we will get to blood pressure in the upcoming lectures. And then atherosclerosis, so this is the medical term for hardening of the arteries. And then cigarette smoking increases the risk of an aneurysm. Cigarette smoking also leads to atherosclerosis and hypertension. So you kind of get a double whammy with that. Drug abuse. So what types of drugs? Well, stimulants that increase blood pressure, especially illicit ones like crystal methamphetamine or think cocaine. If you have people who take these drugs constantly, they're at increased risk of aneurysm because that also stimulates hypertension, and also it also damages the heart as well, but I think that's a little advanced right now. And infections, thing is that sometimes people who do drugs, they don't necessarily use clean needles, so infections can also increase your risk of aneurysm. And also because why? If you have all these things that inflame the blood vessels and cause them to weaken, that can make them prone to rupture. And age is also a factor. So the older someone is, the things that our body tries to repair itself, but our body breaks down over time. So if the blood vessels also have a breakdown in their tissues and structural integrity, that kind of increases our risk over time. Now, this is potentially scary statistics. So about 1 in 50 people have unruptured aneurysms. But does that mean 1 in 50 people are guaranteed to die of a ruptured aneurysm? The good thing is that of those aneurysms, only less than 1% will rupture. So that's a good thing. It's very unlikely that these aneurysms will rupture. And in your life of these people who have unruptured aneurysms, it's a very, very, very small chance of a ruptured aneurysm. So it's like, okay, if you do have, this is why when it does strike in people, it's rare, it's sudden. But does that mean everyone should go to their doctor and say, like, can you scan me for aneurysms? It's unlikely to happen, but again, genetics plays a big factor. If you have a family history, maybe disclose that to especially if it's someone if like a close relative, like first or second degree, died from an aneurysm, you might want to discuss it with your doctor. But as we saw in the previous slide, lifestyle also has a big factor in aneurysms as well. But thankfully, aneurysms are pretty rare overall. So blood thinners mitigate the risk of an aneurysm. So that would be interesting fact question. Yeah, so thing is that aneurysms is more about the rupture of the blood vessels, and blood thinners are trying to treat embolisms and clots. Now the thing is that what should we try to prevent in terms of aneurysms? Like say someone does have a familial risk. Hey, what's something that we can prevent here? Notice that all of the ones I listed in this slide, these are all lifestyle things. These are not things that or it's actually, hypertension can be familial, but things that you're able to regulate hypertension, like say it is due to your diet or a high sodium intake. Maybe you can do a heart healthy diet that helps to lower your blood pressure. Or if someone does drugs or smokes, maybe you don't want to smoke or abuse these drugs anymore as well. So yeah, that's why blood pressure is another big factor, and often I think hopefully we'll get to cover it we will cover it in the next 2 lectures. Wednesday is a pre-recorded lecture. I know I had it up on the schedule, but again, just want to remind you, Wednesday will be pre-recorded, so no Twitch on Wednesday. Yeah, so this is why regulating hypertension, if you want to prevent aneurysms, that's one thing you would definitely want to pay attention to, especially if you have a familial history. Definitely check your blood pressure. Relatively easy to check. And if it's a lifestyle, if you have hypertension runs in your family, maybe you will be prescribed medications that help to regulate your blood pressure so that you have less of a risk of aneurysm compared to uncontrolled hypertension.